The meeting is called to order. Let's take attendance. I know that Judge Bigley is on vacation. She's not present. Ms. Griffin?
Present.
Mr. Kraus?
Here.
Mr. O'Connor? Ms. Innamorato? Here. Ivashevic is here. Ms. Howell?
Here.
I know. I want to say Mr. Manning. That's my problem. Manning.
Here.
Mr. Perkins?
Here.
Thank you. Okay, we're going to go into executive session real quickly to discuss litigation, so we will be back.
This way?
It's about us dropping lawsuit because we're filing it.
Okay, we are reconvening community corrections reports, passages to recovery.
Good evening, Board. Greg Price, PRICE, Director of Treatment Operations. Report date for active clients, we have 52 active clients as of the report date. Currently, as of today, we have 42 active clients. No COVID cases, no self-injurious behavior, no suicide reports or attempts, and no overdoses to report. Any other questions from me?
Questions? Ms. Hallam?
Hi. Did you have any folks that left the facility for medical treatment in the past month?
Yes.
Did you have any folks that left by ambulance for medical treatment in the past month?
I don't believe so. I can check and make sure, but I don't believe so.
Okay, and those folks that did go get medical treatment, was it all planned?
Some of it happened on site, but it was like kind of injuries that happened on site, but most of it was like kind of planned out and they had to get transferred to the hospital, yes.
Okay, what kind of injuries?
Somebody had like a staph infection that was already kind of got worse and we had to transport them back. I know that one right off the top of my head.
Okay, I appreciate that. Thank you.
Of course.
Anybody else? Thank you.
Thank you.
Renewal.
Good evening, Adam Zach, reporting for the Renewal Center, 80 AM ZAK. We currently have 96 active clients in our program. In our work release program, 76 males, 2 females. In our drug and alcohol program, 9 males, 9 females. For the past monthly period, we had 27 successful completions, and we had 23 individuals who were either revoked or escaped. Employment, we have 63% of our clients are actively employed at a pay rate of $16.16 an hour. In the past month, we had quite a few reentrants transported by ambulance, mostly due to chest pain, seizures, chronic pain issues, but we had quite a few EMTs report to our centers. 0 COVID cases, 0 non-fatal overdoses, 0 deaths. As you're aware, there was a fire at the 2nd Avenue Commons earlier this week. The jail administrators were very complimentary of how Renewal handled the incident and the quick initial communication and emergency preparedness. Renewal also would have provided meals and temporary housing if needed for any displaced individuals. And then finally, today, we had about 20 reentrants and several staff participate in the Allegheny County Anchored Reentry Coalition Resource and Career Fair. That was at the CVS Resource Center in the Hill District, and it was well received by all participants. I'm going to hand the podium over to Ms. DeTore.
Hi, Elena DeTore, Director of Clinical Services, DETTORE. I just wanted to report that Renewal continues its work with the Institute for Research, Education, and Training in Addictions. We are working on updating our policy and procedures to prepare for ASAM alignment. We are also taking part in a learning collaborative with CCBH and just working always toward bettering our approaches to treatment, and that's all I have. Does anybody have any questions for either one of us?
Ms. Hallam?
Hi. First question is, were there any uses of force in the facility in the past month?
No.
What about any acts of self-harm or attempts at suicide?
No.
And then could you speak to what was you talked about the emergency preparedness procedures that you undertook whenever 2AC caught on fire. Can you speak to what those processes look like?
Yeah, we have a phone system, so if something happens in the community or inside our facilities, we have an alert that goes to everybody's cell phone, if they have a work phone or their personal phone. And basically, we got the order to, shelter in place. No staff or no residents were supposed to leave the building. I think that lasted about an hour or so. And then once the fire was under control and the emergency personnel left, then everybody was able to leave the facility.
Okay, and where did that shelter-in-place order come from?
We have like a system. I'm not sure like what the provider is, but like I said, it's a service that goes to everybody's cell phone.
Right, but who made the call to send out the alert for a shelter-in-place?
Probably someone from our administration. I don't know who.
Okay, it was somebody from Renewal who made that decision?
Probably.
Okay. Did you have any returns to jail?
Yeah, we had several.
How many?
Several.
How many?
I don't know. We had we had 23 escapes / revocations. So
Okay, so of that number, how many went back to jail and how many are still out?
I'd have to report back to you the breakdown of the escapes or the escapes and the returns.
Okay, could you please?
Yeah.
Thank you.
Anybody else? Manny?
Yeah, I just have one question. Last month, a spokesperson from Renewal said that there was a discrepancy within data of like the ACJC program. I just want to make sure that that has been worked out and we're seeing like accurate information here.
It's accurate.
Thank you.
Ms. Hallam?
Did you identify what was the cause for the inaccurate numbers previously?
We did not.
Okay, are you looking into that?
Sure. I know this month's numbers were accurate, so I didn't get an explanation why the discrepancy took place.
Did you know that previous month's numbers were inaccurate?
Last month, yes.
Okay, but you didn't figure out why that was to prevent it going forward?
No.
Okay, thank you.
Thank you. Electronic
Thank you.
monitoring?
Good evening, Board. Steve S. Wine for the Probation Office. So for our reporting period, at the end of the report, we had 656 individuals on the bracelet. During that time, we had 111 that successfully completed, and 7 were removed for violations. So, any questions?
Manny?
Thank you. Oh,
Yes, I have a question. Yeah, last month, we talked about shareable information, mainly about the process, how somebody moves like from the ACJ to the electronic monitoring. The guy said that, they were speaking on behalf of somebody else, but that they would check and see whether or not there's information about the process that you can share to the board.
What process are you referring to? Like,
That's a court order.
It's a court- right, it's a court
How
order.
somebody moves to electronic monitoring. It has nothing to do with,
Well, I mean, like actually what happens next. Only reason I'm bringing it up is because somebody who was about to be put on electronic monitoring asked me about next steps, and I didn't really know. So I'm basically saying, we just want to be like transparent about what exactly the process is, what happens when, just how it goes. You know what I mean?
so we get a court order stating somebody's coming out on electronic monitoring. We notify or try to attempt to get in contact with the individual's contact, where they're going to live, who they're going to live with, so we can get the equipment set into the house before we put the bracelet on them at the jail. So that's, once the equipment goes on or in the house, they get on the next day, put them on from the jail.
And like, are they escorted from the jail to the house?
No, we do not escort, no.
Okay. All right, thank you.
All right, thank you.
okay, public comment, Joseph J. I would ask everybody to please respect the timer.
How's everybody doing today? My name is Joseph J. We'll try to make this really quick. I said this before, I do not know the 2 females, but the 2 officers or prison officials that's male. I know this guy right here, I just don't know his name. I know you as well, can't remember your name though. So I would like to get y'all names because I have an interaction with you, I know for sure. Don't know if it was good or bad, but I have one with you. It's either, I'm gonna say a high 90% of y'all get y'all promotions from dumping on prisoners. And I know this for a fact because whenever a prisoner is assaulted or anything that an officer does to him, I've seen it time and time again where the officer gets promoted and not released or whatever unless he's caught on camera. There has never, well, I'll take this back. I'm gonna ask y'all, all of y'all, can y'all explain or tell us how many officers have been reprimanded or removed for a grievance filed against them by a prisoner? I could say it, none. That's right, none. Now, how many officers have been removed or fired or disciplined for helping a prisoner? Quite a few. Quite a few. You're not allowed to help prisoners, no way, shape, or form. You're only there to oppress them. Yes, you, I know you personally. When I get your name, I'll be here next time with the complaint or the grievance. I know you personally. I know how you dealt with grievances and prisoners. Personally, I know you. So I'm gonna put y'all on the spot every time I come in here. Like I said, y'all career prison officials, and y'all got where y'all got by dumping on people like me. I'm the reason, you're the reason why, people like you are the reason why I turned into a hardened criminal. And I can say that with a straight face, because I came into prison because I had a lack of respect for laws, rules, and authority figures. But when I left, I had absolutely no respect for laws, rules, and authority figures because of what y'all do to people like me behind those prisons. Right? Because y'all got, it's called job security. The more you keep me twisted, the more I keep going in and out that door, and everybody like me. But that crap is over with, because I'm putting all y'all on the spot. Thanks for letting me share.
Thank you. Dalen Davis.
Good afternoon. Dalen Davis, President of the NAACP Pittsburgh Chapter. I'm here today to address an urgent issue confronting our local county jail. Over the past 5 days, the jail has been under either full or modified lockdowns, drastically limiting the freedom and rights of the individuals housed within its walls. One particular unit, 4C, has experienced a mere 10 hours out of their cells in these 5 days. This situation is not only unacceptable, but also a blatant violation of civil and human rights. Staffing shortages have plagued our jail for many years, yet this chronic issue is repeatedly used as an excuse to justify these lockdowns. Lockdowns should be reserved for only emergency situations, not as a daily occurrence. It is imperative that we stop accepting this rationale as a legitimate reason to violate the basic rights of people who are incarcerated. Solitary confinement, which these lockdowns essentially amount to, is internationally recognized as a form of torture. It is a cruel and inhumane practice that inflicts severe psychological damage on those who subject to it. Furthermore, the jail's actions are in direct opposition to the will of the people. The voters in Allegheny County passed a referendum against solitary confinement. Yet the jail continues to implement these lockdowns with alarming frequency. This not only disenfranchises the will of the voters, but also undermines the democratic process and the rule of law. The frequent use of lockdowns has shown no signs of improvement. Instead, it has become a default response by the staff, leading to the cancellation of visits, including potentially crucial attorney-client meetings, and further isolating inmates. This isolation exacerbates the psychological harm caused by solitary confinement, leading to lasting damage that exceeds beyond the walls of the county jail. It is also worth noting that while the jail population has increased compared to 2021, the number of staff has decreased. This imbalance is not sustainable and further highlights the need for systematic change. The jail must collaborate with the courts to find solutions to decrease the inmate population, thereby alleviating the pressure on staff and improving conditions for everyone involved. In conclusion, I urge this Jail Oversight Board to work with the jail administration to address the staffing shortages without resorting to measures that violate human rights. We must honor the will of the voters and put an end to solitary confinement. Only by working together can we ensure that justice and humanity prevail.
Thank you. Tim Stevens.
I think what we heard from the president of the NAACP Pittsburgh branch summarizes the concerns of many of us from the community in this room. So we don't have to necessarily echo those, but support the excellent statement from the NAACP president, Dalen A. Davis. I don't know. I worked at a mental hospital for 31 3/4 years. I can only imagine that if you're forced to stay in a jail cell for those number of hours, and the ones that violated the requirements of at least being out for 4, which is my understanding that happened on 4 days, with 1 on Sunday, with no time out, it does not provide the atmosphere for a healthy jail situation for those incarcerated, nor for the folks with whom they have to work. I actually talked to one of the staff members when I, along with others, were registering people to vote. I was actually quite disturbed by the number of hours he said he sometimes has to work. 60 hours or sometimes more. That is just not healthy, particularly when you're dealing with a jail situation. It's not good on either side. It also takes time away from an officer's family, which is also unhealthy for the relationship between the officer and their spouse and their children if they have them. The continued question of not having enough medical staff, mental health people, and security officers in general remains a concern to all of us in this room that have been community advocates for years. And we hope this board, and I think most of you, if not all of you, have a concern about these issues. And we don't want to beat you up, we just want to lift you up as to how these issues can be addressed directly, thoroughly, and effectively.
Thank you. Kina James.
It's Keena James. You'll get that one time. You'll get it eventually. Last name James. I'm also here to talk about the modified lockdowns. So we found out that the jail has at least one pod on modified lockdowns has had at least one pod on modified lockdowns for the last 5 days in a row. The law requires at least 4 hours of out of cell time for each individual every single day. As someone who has been a victim of the effects of lockdowns in Allegheny County Jail, I can tell you that it did damage to my mental health while being there, even though I am not someone who suffers from any mental illnesses. Solitary confinement is a psychological stressor and can be as clinically distressing as physical torture. It is the duty of the jail administration and the Jail Oversight Board to protect the citizens within the ACJ's walls. creating a mental health issue and further damaging those who already suffer from mental health issues is the exact opposite of that. Most of the Jail Oversight Board was voted into office by the citizens of Allegheny County, and we expect you to uphold your end of the bargain. There are some members of both of the staff at the jail and the Jail Oversight Board that clearly care more than others. And I know there are some members who think, well, don't go to jail. Let me remind you that more than 80% of the people in Allegheny County Jail have not been convicted of a crime. We demand that each person in charge of the well-being of the Allegheny County, we demand that each person in charge of the Allegheny County Jail get on board and take this seriously. We demand that the Jail Oversight Board retrieves a written report from the warden disclosing the reasons why a 5-day modified lockdown was necessary and why this was the only option as required by law. From what the jail staff is saying, it was due to shift change, and that's unacceptable. Thank you.
Thank you. John Kenstowitz.
John Kenstowitz, Kenstowicz. Reframing the social identity of our correctional officers. The Department of Justice has found in their study regarding stress of correctional officers that the plight of our correctional officers is not understood and is undervalued. The DOJ recognizes how a social identity can seriously affect an officer's morale and sense of self. In our current 2024 job satisfaction survey, 190 officers completed our survey. Their answers to the statement, "I feel valued and respected as a CO at the Allegheny County Jail," were 41.9% strongly disagreed with that statement and 39% disagreed, which reinforces what DOJ is saying about a negative social identity. In our survey, I have received 497 individual statements from the officers in their own words that I've been spending hours and hours categorizing and prioritizing. What the officers are saying is that many officers are working 80 hours a week, including 40 hours of forced overtime due to understaffing. Officers have been working these hours for months and even years, and it must stop. It is wreaking havoc with their relationship with their families and their physical and mental health. Recently, the officers' union president emailed the board regarding the need for a meeting with a focus group of officers and the board to discuss this critically important issue of limiting all this forced overtime and its impact on the officers and their families. On March 4th, the board met with multiple frontline healthcare staff and myself and found the meeting, I believe, to be very informative. It is my hope that correctional officers will have the same opportunity to disclose to the board their challenges and the recommendations as the frontline healthcare staff have. I want to remind the board that the board has never done an exit interview with a correctional officer, even though the board voted to do exit interviews in December of 2020, 3.5 years ago. Concerning the March 4th meeting, the board has done no follow-up with the healthcare staff regarding their recommendations. From my perspective, this is an act of disrespect and again begs the question of how much of a priority is the board giving to the... Well, that was a quick 3 minutes. Does anybody have any response or question to this?
John, I would love to have conversations with any staff that you would like to facilitate meetings with.
Yeah.
And I'm sure I can get at least 1 or 2 other board members who would be interested in that as well.
Yeah, well, we're going to be getting that together, believe me.
All right, whenever we're ready.
Diana Hall.
Diana Hull. I'm associated with Penn. Our neighbors in the jail are hungry. In 1996, Pennsylvania spent $9 for food a day per person. As of today, Pennsylvania spends $2.61 per day per person. How can you achieve adequate nutritious meals at $2.61? That's worse than some third world countries. Scientific research on hunger has found that it can make people irritable, aggressive, anxious, impulsive, and more likely to use drugs. Along with the many stress factors associated with incarceration, like being woken up in the middle of the night, adding deficient nutrition only magnifies unsafe conditions for both the incarcerated and the staff. Food that is prepared to be served in the jails is ultra-processed food. A lot of canned foods that contain twice the amount of recommended starchy vegetables, refined carbohydrates, and only half of the recommended fresh fruit and vegetables. Unhealthy food contributes to diet-related illnesses, and it should be noted that many of the incarcerated people are already disproportionately affected by chronic illness. Because hunger is so common in jails, incarcerated people are forced to purchase food from the commissary, and this brings up several important issues. One, commissary food is expensive for families who can least afford it. Because incarcerated people make low wages, the extra expense often falls to their families. It adds hundreds of dollars a month for these low-income families to pay to support their incarcerated family members. Two, the expensive food from the commissary may provide needed calories. However, it's high in sodium, added sugar, refined carbohydrates, which contributes to diet-related chronic illnesses of high blood pressure and diabetes. Inadequate nutrition, along with poor quality food, also increases the cost of medical care to treat chronic illnesses. Providing a nutritious diet could result in significant savings in medical expenses. Penn recommends having a registered dietitian on staff to assess if nutritional requirements are being met and hold Trinity accountable for their $3.5 million contract. We also recommend that all members of the JOB include a mealtime look at the situation when you make your required visits to the jail. Withholding adequate nutrition from prisoners already at the mercy of the jail system and causing health issues that can last a lifetime is inhumane. Basic vitamins and vegetables aren't luxuries. They're the bare minimum to keep the human body functioning properly. The incarcerated have the right to food that doesn't erode their health. Thank you.
Thank you. Sharon Bonavoglia.
It is, again, a relief to be able to acknowledge that there have been no deaths at the jail or its satellite facilities in this calendar year. We at Penn are also grateful for the visits and public reports from both County Controller O'Connor and Mr. Perkins. We strongly encourage all members to make visits to the jail and to issue the required public reports so that the citizens of this county will continue to be informed. It is also, and maybe more importantly, essential to the work you do on this oversight board. It is disappointing that several of you have not as yet gone to the jail, even on a guided tour that Warden Dady has offered, let alone the unannounced visits listed in the charter for this body. Please take the time to do so as soon as possible, particularly as our neighbors residing in the jail are so often living under lockdown, which is tantamount to solitary confinement. Ignoring your responsibility to visit the jail is as problematic as the continued use of solitary confinement, regardless of what the confinement might be called. The law restricting solitary confinement requires that the warden provide detailed reasons for a lockdown lasting longer than 24 hours and why lesser restrictive interventions are insufficient. You need to see with your own eyes what it means to be in a jail cell in order to help you better understand what it might be to be in that cell days at a time with no relief. And now, if you are able, please rise for the reading of the names of the dead. John Brady, Martin Busek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaugh, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tolada, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonomo, Zachary Sam, Nicole Barufi, Richard Shuba II, Sharon Bonavolia, Bonavoglia, PIN.
Rebecca Carter.
Pod 4C at the Allegheny County Jail has been outside of their cells for only 10 hours in the past 5 days. To put this into perspective for the board, only 12 hours in solitary confinement can permanently change your brain chemistry. Pods in the ACJ have been on full or modified lockdown, this for 5 days straight. People who planned for visits with their loved ones had these ripped away this week. To lose those moments with family, friends, or attorneys only adds to the devastation of solitary confinement. The impact of this on people's mental health is unthinkable and lasts beyond their days in solitary confinement. It impacts how their brains work, how prepared they are for court, and who they are when they are released. People visiting loved ones this week took time from their work, spent money on childcare, and drove long distances only to be told sometimes only an hour before that they cannot visit. The people of Pittsburgh have been told different things for the reason about these lockdowns, but I have heard repeatedly that it is staffing shortages. Staffing shortages are not an excuse to override the voter referendum aiming to end solitary confinement, and they are most certainly not an excuse to inflict torture on those incarcerated at the ACJ, because that is what solitary confinement amounts to, torture. The ACJ is inflicting torture on those held there, and at this point, they are barely trying to fabricate excuses. But it has made sad attempts to lie to the public and hide the amount of these lockdowns that have been used. The Jail Oversight Board must find a way to close these loopholes and finally enforce the voter referendum to end solitary confinement. It must ensure that civil and human rights, including people's mental health, are protected within the ACJ. The jail is walking all over this board and the Pittsburghers who voted for the referendum when it uses these loopholes to justify solitary confinement, and it is torturing those incarcerated. Most of the members of this board are not simply turning a blind eye to these violations, but actively causing them by refusing to use their power to stop these lockdowns. While there are no good jails, the ACJ is particularly despicable. I'm disgusted that these lockdowns have continued to be used within the ACJ to justify solitary confinement, and I hope that the JOB knows that the Pittsburgh community stands against it and will continue to be here until this torture actually ends. Thank you.
Muhammad Ali.
Good afternoon, everybody. Muhammad Ali, Muhammad space Ali. I'm here today, like many of those who have come before me and many of those who will come after me, to discuss the absolutely inhumane conditions that the ACJ is currently putting incarcerated individuals through, as well as what the people of Pittsburgh expect this board to do in response to the actions taken by the jail. For the past 5 days, certain pods of the ACJ have remained on lockdown, the reasoning behind which is spotty at best and outright pathetic at worst. What's been commonly stated is that certain pods are on lockdown due to staffing issues, a reason which, may I remind the board, is not an excuse for the jail to engage in the outright torture and degradation of the humanity of those incarcerated within its confines. The individuals currently housed within Pod 4C of the jail have currently received 10 hours of free time over the past 5 days of lockdown, half of what they were supposed to receive according to the solitary confinement referendum passed by the people of this county and adopted by its legislature. Therefore, the ACJ currently engages in acts that are breaking the law, and this board, by refusing to enforce said acts, are complicit. This complicity extends further, however. The United Nations, ineffective as it is, has deemed solitary confinement as a form of psychosocial torture, something that eats away at the psyche of individuals and the physical well-being of people, with 12 hours of solitary confinement already altering the brain chemistry and structure of those unfortunate enough to be forced into experiencing it. This board is complicit in that torture and should be ashamed. This complicity, however, is not simply the pain inflicted upon the individual incarcerated people. It is complicity in alienating them from their families, from their time, from their labor, and from themselves. This board is complicit in denying the individuals currently being isolated from the care and love that they deserve as human beings and in obstructing the lives of their loved ones. We mourn for those who have been stripped of the capacity to experience the fullness of their humanity in community with those who they cherish. Today, I asked this of the board: rein in the dogs running the ACJ, enforce the solitary confinement referendum, and ensure that all those within the jail have access to consistent free time and visitation hours, regardless of whatever petty reasons the jail decides to prevent the undeniable humanity of those confined within its walls. Thank you.
Thank you. Marion Damick.
Beep. Okay, I know I was talking to this. Everybody's talking about what's going wrong, and that's true. Everything that they've said is true. I have an idea, like it or not, of something that might help in this. Don't laugh too much. This happened because both my son and I received interesting cards. One he got from the executive director saying, "Thank you for working at the polls." He and I have worked at the polls for 100 years. We've never had a thank you card come in. Checks come in, yeah, okay, not correct. That's fine. Then, okay, great. Okay, then I look, and what do I have from the controller? Thank you for paying your taxes. Yipes, I said. Nobody has ever thanked me for paying my taxes. It's the other way around. But okay, which said to me, aha, you know which way I'm going. Okay, what if, and there's another thing. Well, one of my aides, she said, no, she worked at a store. Every time the workers came in, they said, the owner said, thank you for coming to work. How about that? How about thanking the staff to coming to work, really thanking them? They would be astounded, I think. And I might do something. If you say thank you, then maybe, and this is something that they can do, if an inmate, and we'll say maybe an if, when an inmate does something good and behaves and what the officer wants them to do, thank you for doing that. It sounds like if it is not. It really makes you feel that you're a human being And that's what the people in jail are, including the staff. They're human beings too, and they're obviously, and they're working at a hard job. They need to be thanked. And I think thanking them would be a really good idea. Thank you.
Thank you. Sammy J.
Hello, can you hear me? I'm Sammy J, Sameyjay, and I'm here to second a lot of what other folks have said about the lockdown at ACJ that's been going on for the past 5 days. Frustrated doesn't begin to cover my feelings, knowing that for 5 days, our friends, family, and loved ones have been on lockdown, some of which not even afforded the full legally required 4 hours time of recreation. As stated in the solitary confinement law passed in 2021, it's required to give everyone incarcerated in ACJ 4 hours of out of cell time every day for recreational purposes. The trauma and undue stress of being locked down in your cell for 22 hours a day, 5 days straight, will have profound impacts on the mental health of our family, friends, and loved ones who are incarcerated. It would happen to anybody. The fear and confusion of their families have been reeling with is beyond measure, and we demand accountability to the existing laws and justice and equitable treatment to the incarcerated community. Thank you.
Thank you.
Thank you. Corey Roma.
Time to adjust this for big guy size. Corey Roma, C-O-R-Y-R-O-M-A. I am here today to address the current lockdown at the ACJ, which has now lasted into its 5th day. While I understand the ACJ has continued to see staffing shortages, while I understand it's continued to see staffing shortages, it has been that way for years and is no way a legitimate excuse for violating the incarcerated civil and human rights. Lockdowns effectively act as solitary confinement, which is a form of torture, is inhumane, and a wanton way to disenfranchise the voters who passed the county solitary confinement ban 3 years ago. Furthermore, I'd really like to know why the ACJ is still in lockdown for a fire that happened multiple buildings down and has long been extinguished. Lastly, lockdowns have proven time and time again not to be effective and have only proven to cause further psychological damage to the incarcerated by isolating them and denying them access to visits, which are automatically canceled once a lockdown takes place. And that makes the ACJ staff's frequent use of lockdowns even more reprehensible. You need to do a hell of a lot better, and remember that every misstep you make puts further lives at risk. Thank you.
Thank you. Tanisha Long.
Like 10 seconds. I actually wrote it for once, which is unusual. And I'm not that tall. Sorry. Tanisha Long. Pod level lockdowns are not a solution to the Allegheny County Jail staffing issues. They're a lazy and punitive way to cover up the jail's inability to hire, and they're a violation of the solitary confinement referendum. I'm tired of coming to this board with the same unsolved issues. Unfortunately, the Allegheny County Jail has confused the law with a suggestive practice and continues using lockdowns punitively to solve their own issues. In 2021, voters passed a referendum banning the use of solitary confinement in our jails. The referendum is clear. Each incarcerated person is to receive 4 hours of out-of-cell time a day, with very few exceptions. This is not happening, as Pod 4C has received less than 10 hours over 5 total days. Obviously, I don't trust the jail to accurately report when they're on lockdown. I'm keeping track myself. Imagine being stuck in a day for 20+ hours, sharing space and air with another person you may or may not even like, toilet time, bedtime, nap time with someone you may or may not like for 20 plus hours a day, recirculating the same air. Today, this morning at 7:15 a.m., I was called by the jail to notify me that my 8 a.m. visit was being canceled. I have to be in the jail by 7:45 for an 8 a.m. visit. That means the jail gave me half an hour's notice to let me know that my visit would be canceled. The person who was coming with me came from Beaver. That's an hour-long drive just to know that they would not be able to see their loved ones. After 5 days of barely any social interaction, the jail takes away the one thing that incarcerated people have to look forward to, which is that time with their loved ones. Since the last meeting, the jail still is not following its visitor policy and is forcing those with canceled visits to wait another week until their set day. We're factoring in childcare, missed work, travel expenses, all the sacrifices families are willing to make if they could actually see their incarcerated loved ones. We fought to get rid of Warden Harper because we wanted better for our incarcerated population. But Warden Dady is not much better. He's continued the same harmful practices that existed under Warden Harper with no indication that he has a desire to do better. And while I know it'll take months to find a replacement, we do not have months to end the inhumane practice of solitary confinement in our jail. We have a right now responsibility. Staffing is not an excuse to violate human and civil rights. The jail population continues to increase while staffing levels decrease. We have 2 judges on this board. They have a responsibility to work with the jail to decrease the jail population. It can be done, and we did it during COVID. It can be done. We did it by 33% during COVID, and right now, it has risen to almost meet those pre-COVID levels. I'm unsure why, but the jail has gotten comfortable violating the law. Maybe we're not loud enough. Damn it. All right, give me 2 seconds. Maybe we haven't applied enough pressure, and maybe we need to start exploring our legal options. But what I do know is that there's someone in that jail that I don't play around about, and that every person in that jail has someone on the outside who doesn't play about them. Do better.
Anna Yetzko.
Hi, ANNAYATSKO here in my personal capacity. In May 2021, voters passed a referendum to end solitary confinement. In December 2022, concerns that partial lockdowns going on in the jail violated that solitary confinement referendum. In April 2023, Judge Housey says that a non-current county solicitor gave a legal opinion about solitary confinement in executive session. According to that opinion, the partial lockdowns on individual pods that jail administrators logged in monthly segregated housing reports violated the referendum. So we've been aware of this issue of the violation for over a year, aware of what voters made into law for 3 years. Every month, the jail reposts this referendum at the beginning of their monthly report. In May, they then proceeded to log 19 partial day lockdowns and 11 full day lockdowns. A lot of those are back-to-back days. Detailed reports and timestamps were not included. How long is a partial lockdown? Staffing is blamed. Many people have come here, including the union president, with suggestions to improve hiring. That hasn't been fixed. Now we hear many officers are working 80 hours a week, including 40 hours of forced overtime for months and years. That was never fixed either. So staffing's being blamed for these lockdowns, but it was the responsibility of the county to enforce the referendum, and now there's been a blatant ignorance for years of what's necessary to do that. Now every hour that we sit here, people are being hurt. Whether it's called solitary confinement or not doesn't change what it's effectively become, and according to Judge Housey, the board has been told as much for over a year. It should have been fixed then, and now it's crucial to take emergency measures to fix, because again, every minute we sit here is torture for the people in there. Thank you.
Miracle Jones.
Hi, my name is Miracle Jones, JONES, a resident of Allegheny County. First, I want to talk about solitary confinement, lockdowns, modified lockdowns, restrictive movements, whatever you would like to call it. First, we need to ask ourselves, why is this happening? Who benefits when the jail is on lockdown or solitary confinement is used. We often think of social and emotional effects of jail lockdowns, but we rarely think of the people and systems that benefit every single time the jail places our loved one on lockdowns. First, the county. The county saves money on staffing and has no motivation to address their staffing needs. It is easier to lock people down and run understaffed pods, and the county can also make money off the phone calls and apps on the tablets. Businesses and corporations like GTL and Viapath, because incarcerated people have to pay to watch movies, play games, talk to their loved ones, and replace in-person visits with video visits. The more there's a lockdown, the more they have to pay, and the more the county makes. The courts. The courts benefit when the jail uses lockdown because they get defendants that are mentally broken down by the conditions of their confinement, and they become easier to prosecute or coerce into taking pleas because we know by day 3, people lose jobs, housing, access to family and loved ones. When entities benefit at the expense of incarcerated people, there is not motivation to earnestly work to stop solitary confinement. I ask you today to, 1, stop using solitary confinement as requested by the referendum and just basic human decency. When there are lockdowns or any type of restrictions, provide tablet services and consistent communication options for free so that visits are still able to go, especially because there are people who do not speak English who are in the jail and they lack basic language access skills because they're not being provided. So I also want to remind the jail they do have a legal obligation to provide language access to non-English inhabitants. And lastly, work to make sure we are working to reduce the population. My second point, which is the reason I actually came today, is to think about how this composition of the board started and the biases that were put at play. And so I would ask the controller and the county executive to do a racial impact study of the criminal justice system here in Allegheny County. What is the racial impacts of play? How diverse are the employees in the county and the criminal justice system? What are these sentences? Who is being offered diversion programs? Who is being offered access to support, drug courts, rehab, and what is the racial breakdown of that? What is the racial diversity of the diversion programs and the services and the community projects that are being offered to people who are coming through? And are they reflective of the people who are here? Because if biases are showing up in this board, they're probably showing up in our criminal justice system. Thank you.
Alan Gunther.
Hello, my name is Alan Gunther, and I'm with the Pittsburgh Quakers and the Pittsburgh Peace is Possible Coalition. I want to thank you for the work you are doing and the reforms you have promised. But even though you have made these promises, it's not acceptable that there are so many urgent needs that need to be addressed immediately. As you know, there are 0 therapists. That's my understanding. There are 0 therapists for 1,600 prisoners, many of them with mental health issues. John and Keena addressed the lack of staff and corrections officers. And you all know that those who are receiving Suboxone to treat their addiction recovery, that this is administered at 3 in the morning, which is inappropriate, and there's no mental health treatment accompanying the administration of Suboxone for people who obviously need mental health treatment and help. I also work with the Corrections Collective, and they have an expert in Philadelphia who reviewed your job descriptions. And your job descriptions for the therapist especially are lacking, according to this expert who runs her own program, a successful program in Philadelphia. Your salaries are not competitive. You don't offer benefits. And you also don't offer professional development, which would attract a lot of younger people. So the problem is systemic with what you're offering. That's why you're not getting job applicants. You're not offering something that's attractive to them. So in any case, this has gone on for too long with the overcrowding, and with the lack of staffing. Thanks to the ALC and the excellent work that they did, you signed an agreement to release prisoners as long as you can't fulfill the staff positions and you can't do the job the way it's supposed to be done. So I would encourage you to start really thinking seriously about what happens when you start releasing people into the community who have mental health needs, who have need for treatment. When you let folks go, what is going to happen to them? I hope you have a plan in place. Thank you.
Stephen Fisher.
Thank you. I'm Dr. Stephen Fisher, F-I-S-H-E-R. I'm a licensed physician with over half a century of experience, although only a little over a year of it was in correctional health. I don't have the valuable experience of a lot of people in this room, but I've heard a lot of really heartfelt stuff in here today, and I've noticed, looking at the board and at the jail officers, there's a lot of agreement and sympathy with much of what's been expressed, some of which I sympathize with directly. I had someone asking for a visit yesterday. I showed up only to find out that 5 minutes before I arrived, it had been canceled because of a lockdown, and no call was possible because of the lockdown, and my parking had already been paid, which is a negligible problem for me, but it's sort of a major problem for the guy who's going to visit who has no idea why he is there, and much of today was spent by me trying to talk to really hard-working people in the jail who also don't know why he's there and don't know how to find out and are overworked and can't answer the phone till 8 or 10 tries. And I thanked them, and much of what Marion said when I drove here is really fair. People do want some appreciation. I've also been a judge of elections, and it's so nice when people say thank you. When I was in the prison, it was nice when an inmate or their relatives said thank you. One way to thank some of the hardworking corrections officers, it's not going to go over well, would be to pay them decently. Very few grew up hoping that that would be their career. Some may have. Some of them are just in that job trying to survive. I know there's a financial problem for the county as well. No one wants taxes raised. I don't know. I don't have the answers to these. I really don't. I'm just so empathic. Names were read. 3 of them were people I've known while we stood up, one of whose widow I've talked to this week. I wish I had the answer. I know you all do too. We're really all trying to do our best. I hoped I had something better to say, but I don't. I'm sorry.
Thank you. Joe J.
Here.
Oh, okay, then that's it.
My name should have been below. Jody Lincoln? Oh, Jody Lincoln, yep.
Oh, did I miss you?
Yes.
I apologize. Jody Lincoln, I'm sorry.
Hi, Jody Lincoln, Lincoln, and I'm gonna finish us off with another lockdown comment, because you know what? It's another day, another lockdown, another violation of the solitary confinement referendum. This comes as no surprise to anyone, as the jail is known for blatantly violating the civil rights of incarcerated people and the law. This board has not taken meaningful steps to hold the jail accountable, so the jail continues to act with impunity. Unchecked human and civil rights violations continue to harm our incarcerated population in ways that are long-lasting and life-shattering. Because we know solitary confinement is torture. That's why Allegheny County residents voted to get rid of it. We don't believe in torturing individuals here. Individuals are locked down routinely because of inadequate staffing, for broken elevators, maintenance issues, or whatever the jail decides that day. This is not acceptable, and this board has made no moves to hold the jail accountable to the local law. What is the point of a new board and new board members if we have the same old problems? For 3 years, we called out Warden Harper's use of the lockdowns to violate the solitary referendum and his creative reading of the law. The new warden and administration feel just as empowered to use the lockdowns to address staffing issues. The answer to this problem is clear. If Allegheny County jail cannot operate at its current staffing level without breaking the law, then the jail needs to work with the courts to identify people who can be released to help reduce the number of people in the jail. We successfully did this during COVID, and we can do it again to address the current staffing crisis. We will all continue to show up until the jail follows the law and every incarcerated person receives their time out of cell. We will keep coming until you stop violating the laws and treat people like humans. This was a lot of comments about one particular issue, and we will keep coming back every month to hammer this point home. Thank you.
Thank you. Okay, do I have a motion to approve the meeting minutes for May 2nd?
I'll second.
All in favor?
Aye.
Any opposed? Motion carries. Old business, any old business?
Judge Vashvik, before we get started, I just wanted to ask that since the warden left the last meeting early, if he could please cover in his report today the items from last month's agenda that he did not cover. I have questions that were from last month, specifically about the seesaw training materials that you see here on the May agendas, warden report, and the OSM system notifications. Those things were not covered. I believe we did get the list of jail policies and procedures via email, and so just wanted to...
You just want to ask questions regarding items that you didn't get a chance to ask them about because the warden left.
Well, and also whatever his presentation was planned to be for last month regarding the seesaw training materials.
Okay, that's...
Because I assume it was prepared since it was on last month's agenda under his report. So I would like to get that information tonight and then ask my questions.
I think he said, I think the jail's response was they didn't have any information, is my recollection, but I'm not sure.
I don't have seesaw information, so
But if you want to ask questions on that topic, that's fine.
Okay. Can I just also ask why it was on the warden's report for last month if you have no information on it?
Because we had asked them. That's why we put it on the agenda, because the question was posed.
I don't create the agenda,
I don't recall
so I don't
that
know.
I was going to provide seesaw information, but
It's on the May agenda, but you left.
The jail doesn't prepare the agenda. The controller's office prepares the agenda. I review the agenda, and the item was on the agenda because a question was posed by this board to the jail to provide any information they had on that. I believe the jail sent an email to this board saying, we don't have any information on seesaw. Somebody can correct me if I'm wrong, because this is from...
What I remember being told, which I dispute that this is the truth, but what I remember being told at the last meeting is that they do not have the actual training materials that were used. That's the only information I remember us receiving about that, but anyone else can dispute that. Okay. Yeah, so I would like to just say that since that was on last month's agenda, I would assume that you were prepared for last month. So I am going to ask questions about that in this month. And then also, I do have a question, though, just based off what you just said. So you're saying when we get this agenda each month, the things that are listed under Deputy Warden Report, Chief Deputy Warden Report, Warden's Report, none of that comes from the jail? That is all written up by the Controller's Office?
To clarify, Councilmember, if I can, we generate a list of requests that the board members have, and we put that on the agenda. We send that as a draft template to the entire board 2 weeks prior to each meeting. So those are in your inboxes for review. The board members then get to add, remove, edit the document. Our job is merely ministerial in that function. We just help them move the agenda through the the offices. Then it gets finalized, and based off the recent bylaws, there's that 2-day agenda will get posted online at least 48 hours prior to the start of the
Right, I understand all that. My specific question is about what participation does the jail or jail administration have in the items that are listed on the agenda for each month?
I cannot speak to that. I have no knowledge of that either. I again, prepared a draft agenda as a courtesy to send to the board to get business going between each meeting.
And you never at any point receive input from the jail or jail administration about what to include on that agenda?
Not received
Okay.
any correspondence from the jail regarding the agenda.
That was my question. Thank you very much.
However, I consult with the jail and ask them if they have any additions or corrections that they would like on the agenda.
Okay,
So,
I was
okay.
wondering that. I didn't know that. Now I do.
And the only addition or correction that you would see is between the draft, which you get, and then the final, which you also get. And there's very rarely any changes.
Okay, thank you.
Okay. All right, any other old business? New business? Mr. Perkins?
So the board had pre-existing subcommittees that were pretty narrowly focused, with a books committee, an exit interviews committee, and they're all very important issues, but we had discussed, or I had proposed that if we could have broader subcommittees that would be more, they could be nimble enough to address different issues depending on what the priority is. And, as a board, for us to accomplish things and to get things done, because we are listening, subcommittees are a way to get things done in between meetings, so we aren't coming, after 30 days, there's been no progress. The subcommittees can move the ball forward meaningfully with a more narrow focus. So that's some introduction to say that my suggestion is that we modify and create new subcommittees that would be more encompassing and broader to address several of these sub-issues. So instead of, in lieu of an exit interviews committee, for example, we broaden the committee's mandate and call it the Employee Welfare Subcommittee. And it will be focused on issues such as retention, recruiting, and things of that nature. Relatedly, I suggest that we replace the existing IIWF subcommittee, the Suicide Prevention Subcommittee, the Library Subcommittee, and put those issues under the umbrella of two other subcommittees. One would be the Incarcerated Person Welfare Subcommittee, which could work in between meetings, interface with the jail, and address issues that come up and arise in between meetings, such as lockdown issues, such as issues with tablets, and hopefully we can collaborate with the jail to address issues in between meetings in a more timely basis. And then the healthcare subcommittee, which has already been established, could address issues related to physical and mental health. So with that, I suggest that we keep the healthcare subcommittee and then replace the other existing subcommittees with an incarcerate welfare subcommittee and an employee welfare subcommittee.
So we have a motion to reorganize the existing committees and replace them with two new committees, the Incarcerate Welfare Committee and the Employee Welfare Committee. Is that correct?
Yes.
Motion by Mr. Perkins. Second by Mr. O'Connor. Question on the motion. Ms.
So
Allen.
is the intention for there to be 3 subcommittees total?
We could have more, but those 3 would cover the issues that we just discussed. So it'd be healthcare, incarcerated person welfare, employee welfare.
Okay, I'm just concerned about if we do limit it to that many committees. We made some really restrictive rules in the illegal bylaws that we passed last month. And so there are very few people that are allowed to be on each committee, and I'm very concerned that many members of this board will not actually get to participate in the committee process if there's only 3 of them in these broad categories. In the past, that was why we had the more specific committees, was so that many voices could be heard and work on the issues together. So,
Ms. Inamorado, you want to comment?
No, I just had a question.
Oh.
So if we
But the point is to be able to meet in these subcommittees, to be able to do work, and have, the opportunity for public voice and community voice to be at the table as well, working with the GOB members who are members of these subcommittees, correct? That is the intent?
Yes.
Okay. So we have to abide by a limitation of the number of jail oversight board members so that it doesn't become a jail oversight board meeting. Yeah, so we need under a quorum to be available, to be present on these subcommittees, correct? So we're not in violation?
Correct.
Okay.
Okay, so Ms. Hallam, we're not limited to only these subcommittees, okay? Are you proposing an amendment to break it down further?
I would propose more subcommittees than we have and to be less broad and more specific. There is so much, if, let's say, I love the ideas of those three, I just wish there were more. So like the Incarcerated Welfare Committee. I mean, in my opinion, every single aspect of what this board does is for the welfare of the incarcerated people. So to say that we're going to have this subcommittee where this is what we're going to do, well, shouldn't it be broken down into books and lockdowns and uses of force? And it seems that medical is really the only thing that we have separated out in the healthcare advisory subcommittee. And so I am concerned about, instead of just revamping the old ones or maybe modifying them and adding some new ones, which is what I thought was the plan, that we're going to just kind of try to remove the public aspect of the Quorum Sunshine Act required jail oversight board and put it in a non-Sunshine Act required subcommittee.
That's not my intent.
No, Rob, sorry, I want to be very clear. I am sure that is not your intent at all. I'm just worried about the unintended consequences.
I understand that point. Kind of my point is of like getting things done, because I think we all want to get things done, that if we have 12 subcommittees all focused on narrow issues and staffing them, that it's, let's have 3 or 4 subcommittees fully staff them and get things done. And versus if we have, because another perspective is that, like, since I've been a board member, I don't know that any of these subcommittees I've ever met, I don't even know who's on them. So
They haven't been filled. So that is correct.
Yeah.
Can I just add something? There, of course, hearing from the public comments and the information that we receive, we know there's so many issues that could fall under any of these committees. So what I would envision is at least we start with these committees and start identifying priorities, because we can't do it all. We can't do it all right away, and we're going to have to kind of figure out what we tackle first. And so maybe, we start broadly and begin to narrow down and figure out what the priorities are, and then we can always create additional committees when we think that there's something in particular that needs, a particular urgency or needs particular focus, that we can carve that out as another committee. I'm not opposed, though, to creating more committees right now. I'm not sure what those would be, but we can start broadly and start tackling some of these things, as Rob said, to get stuff done.
Ms. Hallam, do you have a proposal to maybe, because I also think these are huge umbrellas, and that's not a criticism, but I'm thinking, well, is there some way we could break the Incarcerated Welfare Committee at least into 2 at this point in time? Just go ahead.
I do have some suggestions if you're amenable to a friendly amendment. So the first thing, I think it's been very clear tonight that lockdowns is its own subcommittee in itself. I would even be open to the idea of like lockdowns and uses of force, since those are 2 things that we've been really concerned about that I think are related. I like the healthcare idea. I think that's great. It needs to be its own one. I think something along the lines of books, education, tablets. I don't really know how you would work that together, but I'm again trying to take the umbrella and break it down to at least like 2, maybe at the most 3 chunks. I do think the Employee Welfare Committee, while I don't love the name of it, I understand how much that impacts the welfare of the incarcerated individuals, so I do agree with that one. I do agree with the healthcare one, but I think that third one, I would be in favor of voting for this if we broke that down into maybe 3 instead of 1. So yeah, lockdowns, use of force would be my proposition.
That's pretty narrow.
But it's such a big issue, and it's every single month. I mean, the numbers that we have on how many lockdowns and how many uses of force, I think, warrants its own subcommittee, especially full of people who really do care about that and want to get to the bottom of that. I'm open to anybody else who thinks that they should be a little bit more specific. I did like the fact that we had an incarcerated individuals welfare fund subcommittee that was specifically about how to spend the money in that fund. We use it now to fund the next motion, the $125 a month, but there are other things we should be doing and looking into doing with that as well.
Okay, how about just to get something done, because we never get anything done.
Doesn't have to be that way.
I know, but, okay, we do have these two committees to be formed on the table. Mr. Perkins did send an email suggesting this. No offense, but you sent an email saying, great idea, okay? Like, why don't we form these two committees, fill these two committees, and then let those two committees meet, make priorities, and recommend some subcommittees, just to get started.
Can I at least ask to amend then to get started, the incarcerated person welfare committee? Can we at least add one more that is the lockdowns and use of force subcommittee? Would you be amenable to that?
How about this?
If that's the case, I would be in favor of voting for this.
How about, let me make one more suggestion, because we already discussed that we're going to reschedule our meeting on the lockdowns and use of force. Okay, and we are going to schedule it tonight, okay? Why don't we do that first?
I'll do this first. While we're on appointments again.
What's everybody's?
Sorry. I would just say we have two, add a third, and then, when it comes to books or something like that, that could fall under one of the others, but let's get three and start meeting. So there's already a motion, a second, so we just need to amend to add the lockdown committee.
Yeah, lockdown and use of force, if you're cool with that.
Second.
I would appreciate that.
Yeah.
I motion to amend if you would second.
Second.
Thank you.
Okay, all in favor of creating a lockdown and use of force committee? Do you want to, let's do a
All
roll
three
call.
together, yeah.
Well, this is on the amendment to Mr. Perkins' motion. Okay, so, on the amendment to the motion, Ms. Griffin?
Yes.
Mr. Kraus?
Yes.
Mr. O'Connor? Ms. Innamorato? I'll vote yes.
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 Okay, so we now have 3 subcommittees. The motion has been amended. Does anybody want to second the amended motion?
I'll second
Is it not 4? I'm sorry.
No, we already formed the health care
Oh, okay.
subcommittee. That's
Three
done.
more. Got it.
Do I have a second?
I'll second.
Okay, all in favor?
Aye.
Any opposed? Okay. All right, as to the healthcare subcommittee, the appointment committee, okay, met and discussed, and it's in the order of responses who's going to be on that committee. Ms. Innamorato and Mr. O'Connor proposed the formation of the committee and want to be on the committee. Mr. Perkins was the first to express his interest in being on the committee. So those 3 are going to be on the committee. Ms. Griffin was the next person in line who expressed an interest, so she will be the non-voting committee member. So that's done. And you all can get together and schedule a meeting at your leisure. Okay. We also have a motion, Mr. Perkins, you have another motion?
Yeah, as Councilmember Holland alluded to, we have the $125 a month disbursements through the IIWF, and I think we do need to look at that in the future to kind of understand, funding streams, are we being as impactful as we can with that? But the money's going to run out in June to give us time to understand, what the next step is. The motion is to continue funding through the end of December, and in the meantime, we can discuss what the next steps are.
Okay, I'm going to make a motion to amend that motion to fund it for 3 more months instead of 6 more months. And the reason that I'm doing that is the history of this, as I understand it, is that this was started during COVID when there was a problem with getting food in the jail, and food distribution to the jail was started during the pandemic. And that was the whole reason for it, is because food service to the jail was inadequate, or the jail wasn't being supplied with food. I think there's a problem with solvency, and I think that this is fiscally irresponsible. And I just think that this board has never considered, I think there are probably 1, 2, 3 members of this board who voted on this in the way that these funds were going to be expended, and the rest of the board had no participation in it. And so I'm only suggesting that we amend it to go for 3 months so that we can decide, as Ms. Hallam just said, this might not be the best way to spend this money. And I think it should
I
be
literally did
reevaluated.
not say that even once, that this is not the best way to
I
spend this money.
thought you said that it should be reconsidered.
No.
because-
What I said was that there is additional money because county council changed the funding streams for the incarcerated individuals welfare fund so that the cost was never an issue. So it used to be just the profits from commissary went into this account, when maybe 10 years prior, it was phone call profits and commissary profits. So as a result of a county council action, there is more money going into this account than there has been in
Thought
a
it was a
decade.
one-time.
It was not a one-time thing, it's the law. We changed the law to make it that way going forward.
What does it say? What is it? Is it an annual
It's all profits
contribution?
derived from the phone calls and the commissary
Yes, I
accounts go into this.
understand that, but
It used to
county
be
council had to supplement.
one time
the
because
funds.
that was prior to us passing that law. We now passed it so that the profits go into the incarcerated individual welfare fund from both revenue streams,
Okay,
as opposed to
and
just
that's
one, so that it would
fine.
never run out.
That's fine. All I'm suggesting is that there might be a better way, or a better split, or a better way to spend this money. Maybe this is the best way. Okay, I don't know. I'm suggesting that this board consider this revenue stream. Obviously, it has to be spent on the incarcerated individuals, but maybe that's the way that it's being spent isn't the best way.
So
That's
I
all.
also just want to correct the record too. It was not about the quality of food was not the reason that this started
It
happening.
was the lack of food. I didn't say.
No, it wasn't the lack of food. It was because the cost of commissary was so high and the cost of phone calls was so high. It did absolutely start out of COVID because folks were out of work on the streets and were having a hard time supporting their loved ones who were incarcerated. But the reality is that is still the case today. The economy is still trash. We have not, economically recovered from COVID. It is still very expensive to talk to your loved one in jail. It is very expensive to buy commissary items in jail. That has not
Okay,
changed at all.
I'm not trying to argue that this is a bad idea. I'm trying to argue that this board has never discussed it or considered it. And maybe after this board discusses it and considers it, this board will say, this is a great idea, let's keep doing it. Okay? I don't know that. So I'm only suggesting that we say, let's do it for 3 months and let our new subcommittee consider, is this the best use of these funds? I don't know. Yes, Manny?
Yeah, I would like to speak on this only because I think it's important. One of the things that my org does as commissary support, I got a phone call on the way here as I was parking, actually, asking, could we donate to their commissary? And I said the reason we stopped doing that, or we fell back on doing that, is because of the $125 that this board gives them every month. And, it was coming out of my pocket and I was getting broke. You know what I mean? So, I only say that because it's extremely important, for them. They rely on that to survive. Of Of course, it's like talking to family members. Of course, it's, spending money on the tablets whenever they're locked down. But more than that, it is hygiene, it is food, it is how they survive. The meals that are provided by the jail are inadequate, So this money is, extremely helpful to them. And another point, we table outside of the jail when folks get released. Any money that they had left over, they're supposed to get it on the check. We'll ask about that later. And that money that they get helps them get back on their feet later on. So I think overall it's beneficial, and I think we should continue to do it for as long as we can.
Manny,
Yeah.
I'm not suggesting we stop it today. All I'm no, I didn't, Ms. Hallam. I made a motion to amend the motion to pay for 6 more months to amend it to pay for 3 more months so that this board subcommittee could examine the issue and decide if this is the best use and best way to expend these funds in the best interests of the incarcerated individuals. That's what I said, 3 months instead of 6. I didn't say stop it now.
If your concern is in the best interest of the incarcerated individuals, I do implore you to go and talk to them, because when we walk into the doors of the jail, it is who they know us and this board as, is the people who make it that they don't go to bed hungry every night. So if that is truly the concern, and that is truly this new committee, the Incarcerated Welfare Committee, let's defer to them.
Yes, that's what I'm suggesting. What doesn't anybody understand? I said make it 3 months instead of 6 months. What's the big problem?
It was your comments that followed that led us to believe that it was not something that you were interested in considering
Okay, well,
and
let me
exploring other
correct you
options.
that is not accurate. I also said maybe after the committee explores this, they'll say this is a great idea and let's continue it. I think you didn't hear that because you have some preconceived notion of what I'm thinking. What I'm thinking is let's make sure this is the best idea. So let's just review it in 3 months instead of 6. I think that's prudent. There's only 3 members of this board who ever had anything to do with this or knew about it or voted on it. That's enough discussion. I make a motion to amend. Do I have a second?
I second, and I will say, I've had an opportunity to study a lot of things in my few months on the board, but this is not something I've had an opportunity to study, and I would like to learn more about it. I don't feel, I understand that it's a good thing, and but it's hard to vote on something, extending something that I just don't know that much about, and I would love to learn more about it.
Well, thank you. I feel the same way. All in favor of the amendment to the motion?
No.
Yes.
Okay, roll call. Ms. Griffin, yes. Mr. Kraus?
Yes.
Mr. O'Connor?
No.
Ms. Innamorato?
No.
Yes.
No.
No.
Okay, so the amendment does not carry. So let's vote on the motion. All in favor of the motion?
Aye.
Your Honor, I think the executive was going to talk, and I did have one more comment.
Oh, I apologize. I'm sorry.
Was going to provide context.
I'm sorry.
No, I just wanted to make folks aware that the fund is solvent, and the 6 months gets us to December. We work on a calendar year as it pertains to our county budget, so this would bring us up into the next budget cycle when we're voting on the entire expenses of the county. So in my mind, this is continuing it, the status quo as it pertains right now to the way that the program is administered, and then we can reevaluate that in the context of the whole county budget and move forward from there with recommendations from the subcommittee. So that's the only reason why I'm voting for 6 months.
Okay.
And just, sorry, we also have that report that we put out online, and it's in there as well as where the money was, where it's going. It's only up to date till May, but we haven't had June's numbers yet. So just, if you want to look into it a little bit further, that's the breakdown. We were doing that for the last few months, I think. Thanks.
And just one question, is the alternative to not doing 6 months, not having it at all?
No. No, we would just vote in 3 more months, that's all.
Okay.
And reconsider it if we elected to.
No, if you do not vote yes on this motion, they will not get money next month. That is correct.
Okay, that's.
Oh, yeah, on the motion that we're about to vote on.
Yes.
I'm sorry, yes, correct. Mr. Perkins?
Yeah, the purpose is to make sure people get paid, so this is trying to advance welfare could please everyone, I mean, the subcommittee can figure out, study these issues within the next couple of months. And we have a plan.
Rod, do you mind turning on your mic?
So we can work on the issue immediately, but I understand that just from a budgetary perspective, it makes sense to do it by year end, but I think we can come up with a plan in the meantime. But ultimately, like, we're on the same page here. I think we want to make sure that people get paid next month, and that's the purpose of this motion.
Okay, all in favor?
Can we do a roll call vote, please, Judge?
What for? All in favor, say aye.
Aye.
Any opposed? Motion passes. Warden's report.
I'm sorry, before you begin, just under new business, I wanted to let folks know that the county has engaged with a firm called Polyhire, who will conduct the warden search. We did do an introductory meeting at the end of May, and there has been a search committee that's been formed, and there will be a press release outlining that available on the table as you exit if you want more information.
Thank you. Warden's report.
Good evening, Board. I'd like to begin by addressing some questions last Jail Oversight Board meeting that was provided to the Board earlier this week. We have ensured that paper grievance forms remain available on every housing unit. Other paper forms now primarily utilized on the tablets, including inmate request forms, the complaint form, and the sick call form. Incarcerated individuals are informed by the pod officer if their visit has been canceled. Those housed on the intake units do not receive visits because typically they are not housed long enough for the visiting process to occur. During the time frame from April 16th to May 15th, the jail requested 4 medical releases and were granted 2. There were also 2 additional releases from requests prior to that time period. All individuals were housed on either 5B or 5E. There were no OMSE outages for longer than 12 hours in May. Jail administration is continuing to work with other county departments to develop the new warden's report as directed by the JOB's new bylaws. We appreciate the assistance provided by our fellow county departments, and we anticipate unveiling the new report in next month's meeting. The jail was pleased to honor all employees during Correctional Employees Week, May 5th through the 11th. We held the annual memorial service outside, and we're pleased to have the county executive attend and participate in the service. We graduated our latest cadet class on May 24th. Magisterial District Judge James Hanley came to the jail to administer the oath to the graduates who were able to celebrate with friends and family in the contact visits room. We continue the process of facility upgrades and replacements. We are also continuing to work with county leadership and human resources to streamline the hiring process at the jail to bring more cadet candidates in. Finally, I would like to again extend an invitation to any member of the board who would like to meet at the jail and have a scheduled tour of the facility. That's all I have this evening. I'd like to turn it over to Chief Beeson for his report.
Thank you, Warden. Good evening, Board. As the Warden alluded to, staffing update, we graduated 17 cadets to full-time corrections officers on Friday, May 24th. The next academy is scheduled to begin on Monday, June 24th, which consists of 24 cadets. Currently, we have 7 males, 2 females awaiting transfer to the PA Department of Corrections. Also with 300B forms, we have 5 males, 0 females with detainers, and 8 males, 0 females with open cases. The longest wait time on a 300B form was received on May 14th, and the shortest wait time is from May 29th. Currently, we have 20 federal inmates in the ACJ, 14 of which are United States Marshal holds, 6 are federal transfers for Allegheny County Court. May 2024, we had 32 use of force incidents. Overtime shifts. Voluntary overtime, we had 1,570 voluntary overtime shifts, 799 mandated overtime shifts, and 2,086 overtime shifts refused using FMLA. There were 0 individuals on a hunger strike for the reporting month. And finally, I would like to report that correctional professionals, LPN Jasmine Oliver and Corrections Officer Michael Demas are the nominee or the awardees for May. We would like to congratulate both. I'll turn it over to Deputy Clerk to continue the deputy's report.
Thank you, Chief. Good evening, Board. For chaplaincy and pre-release, during the first full week of May, the jail celebrated National Correctional Employees Week as well as Nurses and Teachers Appreciation Week. Throughout the week, the chaplains department took part in recognizing the hardworking staff within the jail. Each day, chaplains from a variety of faiths prayed for jail staff and sent out encouraging emails. On May 8th, chaplaincy staff led the 28th Annual Correctional Employee Memorial Service. Former correctional employees who have died were honored by the reading of the names, tolling bell, 21-gun salute, and playing of taps. On May 10th, the chaplaincy department facilitated the presence of 6 therapy dogs from Animal Friends TheraPets program. The dogs and their handlers rotated throughout the day to bring joy and encouragement to employees. In May, the Foundation of Hope began a financial literacy class with Hope participants on 1A and 2C. The course teaches basic banking, budgeting, how to establish good credit, retirement planning, car and home buying. The Discharge and Release Center. The Discharge and Release Center assessed 390 individuals and distributed 89 boxes of Narcan, 160 fentanyl and xylazine test strips, 634 condoms, and 497 bus tickets in May. DRC continues to make referrals and connect individuals to services in the community. Contact visits. The jail is continuing to host contact visits for juveniles, incarcerated workers, veterans, and reentry program participants on designated Saturdays throughout the month. For the month of May, a total of 70 incarcerated individuals received contact visits from a total of 134 family members. Residential placement services. Based on orders from the court, residential placement services facilitated the transfer of 63 individuals to alternative housing in May and 32 individuals to substance use treatment through the diversion program. The diversion program received 35 new referrals and served a total of 90 participants in May. The medical assistance program assisted a total of 117 individuals with completing medical assistance applications upon release from the jail in the month of May. Reentry services. In May, the jail hosted the program Let's Reimagine Reentry. Program representatives visited the Reentry and Veterans Pod and presented on the services that they offer and how they can assist returning citizens to navigate the many obstacles they encounter post-release. Jail Oversight Board member Ms. Griffin had previously asked about the process for individuals to get married. In conjunction with the Marriage License Office, the jail has developed a step-by-step process to aid loved ones who want to get married. The non-incarcerated partner first has to obtain a marriage license by filling out the marriage license application online and submitting the required payment. In order to process the application, the Marriage License Office then facilitates a video call with the jail and both partners. Once the license has been obtained, the non-incarcerated partner contacts arraignment court to schedule a date and time for the marriage ceremony. Arraignment court makes notification to the jail of the scheduled date and time of the ceremony so that the incarcerated partner can be taken to the arraignment court for the marriage ceremony. The jail is continuing to work with the Marriage License Office to streamline this process. Educational services. On May 29th, the jail held a graduation ceremony. This academic year, there were a total of 9 graduates. Of those graduates, 8 received their community high school diploma, and 1 received a Pennsylvania secondary high school diploma. Graduates were able to have loved ones present for the graduation ceremony and celebration. Cap and gown photos were shared with loved ones, and the celebration included a graduation cake and refreshments. The 2023-24 school year ends tomorrow, June 7th. Yesterday, the AIU sponsored an end-of-year celebration for the juvenile population, complete with food, cake, and ice cream. Summer educational services for the juvenile population will begin on June 10th. The summer educational program is a credit recovery program where individuals can earn an extra two credit hours towards graduation. We want to sincerely thank all the educators who support the students in the jail. That concludes this month's report for programs. Deputy Warden Holly Martin will provide the healthcare services update.
Good evening. Medications-assisted treatment for substance use disorder. Our continuation of medication-assisted treatment includes the following during the month of May. There were 39 individuals prescribed oral naltrexone, with 0 individuals receiving the Vivitrol injection prior to community release. 330 individuals were treated with Suboxone. Of these, 24 of those were transitioned from Suboxone to Sublocade to support the recovery. 58 individuals were treated with Sublocade. 8 individuals were treated with Bradaxi. Methadone continuation services have treated 60 individuals. Towards commitments and admissions. During the month of May, 6 patients were admitted and transferred. 15 were committed. 2 patients had their commitment rescinded due to clinical stabilization. And currently 23 patients are awaiting admission with the longest wait time since March of 2024. Tier 4 and 5 mental health data. In the month of May, 1 individual was identified as a Tier 5. 24 unique individuals were identified as a Tier 4. Reporting in queues. Sick call request queues for medical, 16 as of 6/4/2024. 16 per medical with longest waiting 1 day. SCR mental health was 0, longest waiting was 0 days. SCR dental was 9 with longest waiting of 3 days. Psychiatrists, 343, longest waiting 20 days. Mental health specialists were 11 with the longest waiting of 4 days. I wanted to take the opportunity to add additional information of the sick call queues and reporting. The sick call numbers reported are a snapshot of the day that it was pulled and shows how many were waiting. It doesn't reflect how many visits that have been completed for that month and the patient care rendered. For the month of May, sick call for dental, 186 visits were completed. Sick call for medical, 1,156 visits were completed. Sick call for mental health, 437 visits. Medical providers, 1,174 visits. And psychiatrist visits were 1,213. We did have 3 suspected overdose cases, 2 were in intake, 1 on housing unit 6F. Further updates, during the month of May, the healthcare department has been able to onboard 11 staff members permanent status, covering the following areas: mental health RNs, physical health RNs and LPNs, AHM providers, substance use, and mental health staff. We've also been able to maintain level sick call clinics with the providers to address the healthcare need of our patients. To give a little bit more information, during the MAT treatment numbers report, you'll notice a new medication was listed, that is Bradaxi. We now have this medication for the following reasons. This is a newer medication that is becoming more available. We can maintain individuals who were on Bradaxi prior to their incarceration. There are more dosing options comparable to Sublocade. It is shown to work better for individuals on higher doses of the oral Suboxone. And it can be more tolerable for patients who can't tolerate the Sublocade or who have had reactions to Sublocade. Each person is evaluated during their provider visits, and decisions to either transition to Bradaxi is based on each individual encounter. This concludes the healthcare report.
Questions? Ms. Hallam?
Yeah, first of all, can you repeat that drug name? Is it Redaxi? Can you spell that?
Bradaxi, Brixadi.
Is that like a brand name? Brixadi. Sorry, I just never heard of it before. It's a brand name. What is the generic name of that?
I'd have to look that one up.
Okay. All right. It's just not something I'm familiar with. But anyways, sorry. Okay. Questions. Okay, I'm going to start and work backwards. So going off just a couple things that you said in your healthcare report, you said there were 3 suspected overdoses. Can you speak to why they were suspected? Was it never confirmed whether they were overdoses or not?
We wouldn't confirm that. Like within a facility, they would confirm that on the outside. So when we pull these reports, it would just be suspected. That's why we sent them to the hospital to get evaluated.
Okay, so all 3 of those were sent out to a hospital? Okay, and you did not hear back since?
I mean, we would have discharge papers, but that's not something I looked up before coming here.
Okay, and all 3 of those people survived?
Yes.
And what efforts were undertaken inside the jail while you were waiting them to be transported to the hospital to keep them alive?
You just normal treatment?
Whatever you did from the time you identified that it was a suspected overdose to the time that they were removed from the facility to the hospital.
Sure. So, I mean, medical staff was called. If Narcan was needed, they would have administered that. Then we would have had them housed in an area with medical staff present, vital signs monitoring, O2 saturations, things like that to make sure they were okay.
Okay. And all 3 of those things were done in each of those cases?
Yes.
Okay. The next, so Redaxi, I'm guessing it's newish, Bridaxi.
Yeah, Bridaxi.
Bridaxi, okay. I'm guessing it's newish since this is the first time that I'm hearing about it here. Is it something that you're seeing anybody enter the jail with an existing prescription to?
Yeah.
Okay, and is it something that you are doing induction for inside the jail yet, or currently just existing prescriptions?
So they're existing prescriptions. People have transitioned to it from the Sublocade. And again, it's just kind of at their individual appointments, they're kind of talking about it because there is some other benefits compared to the Sublocade. Some people just like the Sublocade better, some people aren't. So it's just, in each visit, they're determining that.
Okay, can you just list some of the factors that would lead you to suggest somebody transition to Bridaxi?
Honestly, just the things that I mentioned in the report. It is shown to work better for individuals on the higher doses of the Suboxone when they're going to come off the oral doses and get an injection. And it can be more tolerable for anybody who has trouble in the past with Sublocade.
Okay, and what do you consider a higher dose of Suboxone?
That is something I would have to get from the providers, dosing-wise. I'm not going to,
Yeah, because my understanding was that everyone was receiving 20 or 24 milligrams.
Well, everybody can't just receive one dose. Everybody would receive the dose that's appropriate for them, by their prescriber.
No, I know that that's what's supposed to happen, but in the past, it has been reported to us that everyone's getting it all at once, this dose at this time. So has that changed? Is that what you're saying?
Everybody does get it at one time.
Right.
But not everybody can just start off at obviously a 24 milligram dose.
Okay, so different people are on different milligrams of Suboxone in the jail currently?
Yes.
Okay, and you do not know at what milligram is determined as a high dosage?
No, I wouldn't feel comfortable saying that.
Okay. How do you make that determination if that's one of the factors that you use, but you don't know what the metrics of that factor is? I'm just misunderstanding maybe.
That's up to the providers. The providers that are, prescribing the medication, that's what they determine.
Okay, and can you list some of the other factors that would go into?
Sure.
I'm sorry, is something funny?
No, it's not funny. It's just very new to me also.
Okay.
So this was the information I brought.
I'm glad you brought
with
it.
a provider. So I obviously don't know everything either about this because it is so new.
Yeah.
Pharmacology is always changing.
Yeah.
She did mention to me that the more dosing options were available to than just a Sublocade. So it's something they look at as well.
Okay, and then you said something, you said that there were 24 people, I'm guessing that was out of the 330 on Suboxone, who were transitioned to Sublocade to quote unquote support their recovery. Can you talk about what that looks like? Is it they were maybe diverting their medication? Is it, I'm just wondering what the factors are that would determine that.
I don't have the individual factors, spelled out in this report that could tell me either way, if it was a version, if it wasn't.
It seems to me that you're not the provider and you're not,
I'm not.
you don't have the qualifications to answer these questions. Is that accurate?
For the medication, yes.
Yeah,
When it
okay.
comes down to the specific reasons why they were transitioned over, I'm sure that's something I can find out, but I don't know that.
Okay.
Yeah, even just broad reasons. I was just trying to understand what are some factors that may be considered. But could we who would be the person to talk to about that?
Well, if you want to give me any specific questions you have, I'd be glad to ask them.
Sure, but who is that person? I can definitely get some questions, but who is the person who would be the one to ask about this?
I would get our providers who are prescribing the medication.
The providers, okay. Okay, and are those all MDs? What qualifications are the folks that are prescribing? Are they like PAs?
In the facility in general, or just for?
When you say the
so
providers prescribing the medication?
They could be MDs, PAs, NPs.
Okay. Okay. Okay, next question is about, we heard about the paper request forms. Last time I was there, but it's been a few weeks, there were still some pods that didn't have paper request forms, but someone specifically was there in May at the facility for a jail visit, and there was no paper medical request forms on 2 of the pods, and so I was just wondering if you could tell me as of which date did you confirm that all of the pods had paper copies of all of the request forms?
We followed up after the last meeting, Ms. Hallam. It's a continual verification. So as our supervisory staff make tours through there, if we're alerted that the forms aren't there, then we replace them.
Okay, but we were told today in the warden's report that all of the request forms are available on paper in all of the pods, so is that a false statement?
No, they're
We
on the
received
pods.
an email from you indicating that. They sent us an email stating that all the paper forms were on all the pods. Is that not correct?
Oh, I know, I'm just saying that I have verifiable information that that has not been the case at least twice. And so I'm just wondering, as of when was that the case? That can I now expect that every time I go to the jail, that any pod that I'm on will have all of the proper paper request forms?
So there's not an indefinite supply of these paper forms on each housing unit, okay? As they get taken, filled out, and submitted, we have to replenish them. So it's a process.
So sometimes-
There may be a gap, but they are available.
So would it be a fact to say that sometimes they are unavailable on some pods,
Very rarely until we replenish the supply.
but sometimes?
Yes, very rarely.
Very rarely.
Okay. My next question is about, I guess I'm going to go into the lockdown questions because we heard about that a lot tonight. I'm so excited that we have a new committee to talk about this because I think it is if not one of the biggest issues that we face here as this body. So first of all, last month, 3-year anniversary of passing this law. I'm really excited about it. And there have been some successes, right? So for Marion, this one is for you specifically. There are a lot of very bad things that the jail has been doing about this, but a really, really good thing is that we went from, in 2019, the Allegheny County Jail used the restraint chair 339 times, and chemical agents were used 122 times. Since the referendum's enactment, chemical agents in the restraint chair have been used 0 times, right? So there are good things that came out of this that we should applaud for happening, but as we heard over and over again tonight, there are still some really bad things. So Marion, for you, yeah. Okay, so my first comment, or question, sorry, is about some concerning language in the monthly referendum reports. So on the executive summary, and this is every single month, when it says, how many instances of a person in jail intake being isolated in a cell alone for more than 20 hours. And I just want to be very clear that there is nothing in the solitary confinement referendum that talks about a person has to be alone to be in solitary confinement. And I thought we had went over this in the past, so I just want to make sure that the jail administration understands that. Are you only counting lockdown, solitary confinement as people who are single-celled? So if me and Manny are in a jail cell together and we haven't been allowed out for 24 hours, would you or would you not count us as on your lockdown report?
So the beginning of your question was, are you specific to intake? Is that what you're asking?
Well, I was just quoting from where it says alone was the language that's specifically in there. But yes, intake also is included in the solitary confinement ban.
Correct.
Yeah.
Intake also has group holding cells, so there's nobody that's isolated unless they're under a suicide watch or some sort of other special needs. And if they are, then they're expedited through the process and moved up to where they need to be. If anybody's housed alone in like general population and things like that, we don't track that, okay? That's a lot of our pod workers on the pods have single cells. There's only one bunk in those. So you know that we have tracking mechanisms in place to ensure that the RHUs, the MHUs, everybody else, we track their out-of-cell time. Is that what you're asking?
Not at all, but I do appreciate that information. But what I am saying is, are you only counting folks on your lockdown report that are single-celled, that are alone in a cell?
No.
So if me and Manny were in a cell for 24 hours together,
Correct.
Would you put us on your lockdown report as in solitary confinement for that day?
Yes.
Okay, so why is the language used in the executive summary in the monthly referendum reports, no instances of a person being isolated in a cell alone? for more than 24 hours.
I don't know, we can look into the language.
Yeah, could we please, because this is an issue that's been brought up in the past, and it was an issue previously that folks were not being counted if they were in a group cell and intake, if they were double celled, and I thought that Warden Dady had remedied that months ago, and I just want to make sure that that is still the case. Next thing, about the facility-wide lockdown. So, again, there is very specific language in this statute that I should just have tattooed on my forehead or something, because I feel like I say it every meeting, that the warden can only lock down the entire jail and must, quote, document specific reasons why any lockdown is necessary. Specific reasons. And not just those specific reasons, but also why less restrictive interventions are insufficient to accomplish the facility's safety goals, right? I do have a copy of the referendum here, Chapter 205, if anybody doesn't have that. Now we turn to the reports, and I have a few of them here in front of me. Every single lockdown on here says safety and security. That is neither a specific reason, nor does it detail why less restrictive interventions are insufficient to accomplish the facility safety goals. So can someone speak to why that has not been remedied? I know even the folks who are new to this board have heard this brought up every month. Can we speak to why that hasn't changed yet?
The specific reasons that fall under safety and security are not for public consumption. That's why it's not published in that report. As I've said in months past, if we want to know the exact reasons for these lockdowns, I'll be happy to go over those forms with any one of you or all of you, okay? So I know we just established a new subcommittee to go over lockdowns and use of force. I would beg to be a part of that so I can give you this information to explain why we do what we do.
And what do you think is different about the subcommittee than this public meeting right here? The information, the subcommittee meetings are also public. They are not executive
I'm going to shut down this line of questioning because
what every
I'm
public speaker
shutting
asked
it
about tonight.
down because we have had it every month.
And we've never gotten
for the
answers,
past
not
3
once.
months. And I have said at the last meeting, we're at an impasse. We need to have a special meeting. We scheduled it last month. It had to be canceled. Now we have a subcommittee. I'm not going to sit here and listen to the same questions and the same answers. Move on.
I have yet to get an answer.
I know.
I have yet to get an answer.
And you're not going to get one tonight.
And you're going to
So
allow
I'm
that?
not- Yes, I am. So
Okay.
move on, please.
Okay. Next question about lockdowns. I will stop it with that question specifically. So another thing, not about the safety and security and the general thing, is that there is no allowance in the referendum for pod-wide lockdowns. There is facility-wide lockdowns with the exceptions that we detailed. There is no exception anywhere in the referendum for a pod-wide lockdown. So I would like to know why all but 7 of the lockdowns on this very long lockdown report are 1, 2, 3, or 4 pods. Where in the referendum is that allowed? Can I ask that question? That is nothing about safety and security at all. I just want to know that. Thank you.
So in Chapter 205, it asks, under the warden's documentation requirements, why less restrictive interventions are insufficient to accomplish that. So instead of locking down an entire facility, we lock down a specific area of the jail as a less intrusive measure to let everybody else that's not affected by that lockdown allowed out of cell time.
But you didn't answer my question. You did not show me where in here it allows a pod-wide lockdown.
Okay, so under letter C, under reporting, subletter A, the dates and reasons for any lockdown of the jail or any section of the jail. Is any section of the jail considered a pod?
I'm sorry, this is under reporting. This is not under the exceptions to the rule against solitary confinement. So no,
So-
I think
So
that,
reporting any section of the jail being on lockdown would imply that we can do that,
I
correct?
do not believe that there is any justification for implying that that creates a new
I would be shocked if you
exception.
agreed with that, I'll be honest, okay? We're not going to agree
Can
on
we
this,
please
Ms.
be
Allen.
respectful here?
We are.
I do not think that your last comment was very respectful. So again, I will ask, can you please show me where in here The
Okay,
jail is
he
low.
showed you, and you didn't like the
He
answer.
didn't show me. He showed me a reporting requirement.
You didn't like the answer. This is the problem.
They
We
can
go-
say whatever
we-
is the problem.
No.
Yes, that is the problem. It has consistently been the problem. They keep doing it because we keep allowing them to do
No.
it.
Wrong. We're at an impasse because the jail the jail administration has been advised by their solicitor.
I'm sure that's
that-
what their solicitor would say.
Excuse me?
I am sure that their solicitor would tell them to not give us information because their solicitor works for them. We do not work for their solicitor. We do not work for them. We exist to make sure that their solicitor can't just stop them from oversight.
Okay, are you done? May I finish? May I finish?
Please finish.
Thank you. They are relying upon the advice of their solicitor that this information cannot be disclosed to the public. They have said time and time again that they will be happy to disclose all of this information to the members of the Jail Oversight Board at any time that we request. I recognize that there has been a huge dispute because you yourself have said many times you want to be able to review this information on
The
your
law
couch.
requires it, Judge.
Whenever you want.
The law requires
Okay, we're at an impasse. They have the right to rely upon the advice of their solicitor. This is not going to be resolved by you asking them the same questions every month and getting the same answers. Maybe it has to be resolved in a lawsuit. I don't know.
Maybe I'm not the problem
Can
here.
I finish? May I finish? Is it okay if I finish?
Please
May I?
finish as long as it results in answers being given and the law being followed.
There's not going to be answers given tonight. That is why we have a subcommittee. Well, we were going to have a meeting. It had to be canceled because everybody couldn't come, okay? I can't help that. I can't help that. The first step, what's the first step? Is for this board to sit down with this administration and look at what they're telling us and look at the records and see why they're saying that it can't be disclosed. How can you render an opinion on anything without knowing what it is? How can you render an opinion? So let's have the meeting and look at what it is that they want to show us.
I would have loved to have the meeting, but it was canceled.
Okay.
I would have
Well,
loved to have a
now-
meeting about this the month before, or the month before, or the month before, any time.
Well, I
in
haven't
the
heard
3
you.
years this law has been passed.
I haven't been on the board for 3 years, and I haven't heard you make a motion to schedule a meeting, okay? I acted to schedule the meeting. Now there's a committee. I said at the beginning of this meeting, let's reschedule this meeting to look at this lockdown information. I said that at the beginning of the meeting. Why do we have to go round and round and round and round?
Judge, I will change my line of questioning. Can you please confirm what the judge just said, that it's the solicitor advised you to give these answers to these questions?
The point that I was making about the less restrictive interventions is under facility-wide lockdown, okay? It's the second sentence in there. The facility warden shall document specific reasons why any lockdown is necessary for more than 24 hours and why less restrictive interventions are insufficient to accomplish the facility's safety goals. So if our safety goal is to lock down and do something on a particular unit, then that's what we do. That keeps the rest of the facility out.
That is not what this said, but at the judge's request, we are digressing from that line of questioning, and I would ask that you answer my other question, which was, is it true what the judge said, that you were advised by your solicitor to answer the questions with the answers that you just provided to me?
Yes.
Yes?
Well, I mean, he's sitting.
Okay. Would you provide us a written opinion to this board about why you believe that this referendum is being followed and these questions do not need to be answered in this setting?
You address the question to the solicitor would make that decision.
Okay, so you are giving legal advice right now, but you are not the solicitor I should be directing this question to?
Questions to the solicitor's office would go through the solicitor. I don't decide what questions get answered.
But you are answering.
The solicitor directs me to respond.
He has a chain of command. That's all he's saying. He has a chain of command. So if an official inquiry is made to the solicitor's office, correct me if I'm wrong, for a legal opinion,
the solicitor will decide whether or not it's appropriate.
Thank you.
Okay,
You can't make that call, is what you're saying.
So has your chain of command directed you to tell the jail administration how to answer the questions about the lockdowns?
Okay, so let's move on.
Okay. Next question. What metrics are used to lift a lockdown? I see a lot of partial lockdowns on here. Can you please speak to how a lockdown is determined to be lifted?
It would depend on what would prompt the lockdown. So when that goal was achieved, then the lockdown is lifted.
Can you please give an example?
I cannot.
A broad, non-specific example, please.
To provide an example, I would have to give specifics.
Shift change. Elevators being broken.
I could give like 50, but this,
Okay.
I just want to express, okay.
Okay, sir, please don't interrupt.
Ma'am,
I'm sorry.
so,
I apologize.
okay. So do you understand why this is so frustrating? Because that was a very specific, simple question. And if the jail administration cannot answer questions that I could answer, that members of the public can answer, that
I
staff
think
could
we all
answer.
know the answer, so why are you asking it?
I don't know
You
all
just
the
said
answers.
you can give
I could give
50
answers.
examples.
Why can't he give one?
I don't know, he's
Because we don't make him. Next question is, have any mitigation maybe isn't the right word, have any efforts been made to offer incentives for all of the lockdowns that are happening? For example, free 1-hour video visits during lockdowns, free usage of tablets during lockdowns. Has that ever been discussed amongst jail administration?
Not that I've been a part of, no.
Is there anything that the jail does to mitigate the harm that is done by these excessive lockdowns?
Try and end the lockdown as quickly as possible.
Okay. But during the lockdowns?
No.
How long is a partial lockdown? There's lots of partials listed on these reports. So how am I to know when I look at something that says partial day, how many hours that lockdown was for?
That would be contained on the lockdown form that I've offered to review with the board.
Is there a reason it's not included in your lockdown report?
No.
Okay. Okay, next, I might not be allowed to ask these. Okay. So, just going back to a couple things, these are not questions, these are comments for the record, because in the January 2024 meeting, your first meeting, Judge Ivashevik, you specifically told Warden Dady that he was required to provide a specific description explanation each time a housing pod or entire jail is locked down. You told him he needed to do that. He has not done it once. If you want me to reference, it's the meeting minutes from January 2024, pages 124 to 134, so I can send those around to the board and to the jail administration if that's something that you'd be interested in complying with. Let's see, I'm not allowed to ask that or that. Okay, so separate line of questioning specifically about folks who are placed in solitary confinement for mental health reasons. So again, the referendum requires a assessment and documentation for each person that is placed in solitary confinement as an individual for medical or mental health reasons. It says that there needs to be a documented and individualized determination of the necessity for each person's confinement. And then yet again, I go to the report of individuals and all I see is medical or assessment. So I'm wondering if someone could speak to the difference between those two and the differences between those two, medical and assessment.
I would have to review all that as well before I gave any specifics.
Sure. Please review it and please come prepared to the next meeting with that information. The next thing is that, okay, we have seen like a really scary, especially as like a medical professional as yourself, we have seen a really, really scary increase in the instances of folks with mental health diagnosis being held in solitary confinement as a result of their mental health diagnosis. In 2022, there were 340 instances of it. In 2023, that number more than doubled to 745 instances in one single year of folks being held in solitary confinement as a result of their mental health diagnosis. And so I would also ask, while you're preparing to answer that question for the next meeting, that you give us an explanation as to that increase and what is being done to lower that number in 2024. One of the other requirements is that documentation satisfying the medical housing assessment or medical exception is provided. I have never received any of that information. I don't know if anybody else on this board ever has. Could someone speak to why that documentation has not been provided? Like, what a waste of time.
I didn't
It's
really
required
know.
as per, I can cite the.
Just what
Sure. So, when emergency use of short-term solitary confinement for individuals is implemented, which is the second exception to the rule against solitary confinement, if you look at subsection B, no person may be held in emergency or short-term solitary confinement unless the warden has made and documented an individualized determination of the necessity for that person's confinement, and the person has received a personal and comprehensive medical and mental health examination conducted by licensed professionals, and that professionals have certified the person's confinement is necessary for medical reasons or to ensure the safety of others, and that the conditions that have been set forth by the medical or mental health professionals that they believe in their clinical judgment are necessary to protect the person. So it is only supposed to be used in instances to protect that person, and there is supposed to be very expansive documentation that details why that is the case. I have never seen that. I'm wondering if anybody else has, and if not, whether the jail is collecting that and just not providing it to us.
So are you making note of that data?
I would say that there should be information that's provided to, depending on who the individual is, and then we make the determination that they need to be housed where they need to be housed. So we probably have that documentation. We would not provide it due to, it's going to have people's personal information on it. So that would be something that we could most likely bring to,
That's
our lockdown
information that can be provided to every job member, but it cannot be disclosed in a public meeting to the public.
Okay. Next question, and again, this, Warden Dady, I told you this was on last month's agenda, specifically about Joseph Garcia and the Seesaw training materials. So I do have some questions along that, if I may ask this line of questions. How many officers were trained by Garcia, Seesaw, or any affiliates?
I don't know the answer to your question. I was not there for this Seesaw event, and I don't recall saying that I would bring the information to the meeting. I know there was some talk about the Seesaw material. I have yet to see any material with Seesaw on it at the facility.
Okay, I will then direct my question to Chief Warden Beetson. Since you were here, are you aware of how many officers were trained by Garcia or Seesaw?
I was present during the training, but honestly, it was years ago. I don't remember how many were in that program. I would be making a guess.
Okay, so is it safe to say that the jail has no idea how many current officers at the Allegheny County Jail were trained under Joseph Garcia and Seesaw?
That training was never completed. That contract was never completed. if you
I was not talking about completed training. I said just training. How many folks currently working in the jail were trained by Joseph Garcia and Seesaw?
Yeah, I'd have to go back and see who was involved with that training to get an accurate number.
Okay, can you please bring that to the next meeting?
I'll look.
Did you yourself participate in the training?
No.
No. Did you observe the training?
Yes.
What would you say was the difference between participating in the training and observing the training?
I watched the training.
Was it a physical training?
What do you mean by physical
For
training?
example, if I'm sitting and observing a training that is a PowerPoint on a screen, I observed it, but then I was participating in it. If it was a physical hand-to-hand combat, shooting off shotguns that I just watched, but I didn't shoot the guns, I observed but was not trained myself.
Okay, so there was classroom portions of it. There was tactical training, yes.
Okay, and which portions did you observe?
Both.
Okay. Are the people who received training under Joseph Garcia and Seesaw, are they the same folks that were on the jail's CERT team?
No.
No. So no one on the jail's CERT team received training from Joseph Garcia or Seesaw?
No, I didn't say that. When CSAU was contracted with, we had a current CERT team in the facility. The CERT team was stood down, and then we stood up the training for CSAU, which was never completed.
Can you clarify what stand up, stand down means in this context?
We had a CERT team, a special emergency response team.
Mm-hmm.
When we contracted with Mr. Garcia and the CSAU, CERT team didn't perform their functions anymore while we were training the new team.
Okay, so the CERT team ceased to exist during Joseph Garcia's training at the jail?
Correct.
Okay, and then it was reestablished? When?
We don't have a CERT team.
What do you have now?
A correctional response unit.
Okay, so there is now a correctional response unit.
Yes.
And that started after Joseph Garcia and Seesaw's training?
Correct.
Okay. Was everyone on the CRU, did they all participate in the training
In which training?
by Joseph Garcia and Seesaw?
No.
No, okay. So there are, okay. Who else received the training? Was it all corrections officers? Was it sergeants, majors? How was it determined who received Joseph Garcia's Seesaw training?
Mr. Garcia did interviews and determined who was going to be receiving the training.
Okay. Was there any other check on that or approval on that, or was the decision solely up to him?
He consulted with me.
Okay. Was anyone else involved in that?
I believe Warden Harper to a limited extent.
Okay.
Yeah.
Did anyone who was trained by Mr. Garcia and Seesaw, did they then train any other officers in the jail?
Can I ask why this is relevant, where you're going with this?
Because there is, I want to know the tactics that Joseph Garcia and Seesaw trained on. I want to know how many folks in the jail are currently using that, because we did ban those weapons that were brought in as a part of that training, and I am eventually going to be asking questions about those weapons as well. But there are people who were trained on this, and I am concerned that that training is still being used today, despite this body stopping it.
Okay.
So
why don't you just ask the question instead of...
Well, I just think all of these pieces are very relevant. I'm trying to find out who in the jail has been trained. I'm trying to determine if they then trained anyone else. I'm trying to determine
Okay,
if the
but if they're
CRU...
not allowed to use those methods, then we have to presume that they're not using those methods.
We do not have to presume that, because I have seen with my own eyes.
What year was that?
Maybe 2-3 years ago. So there are many, many people still employed at the jail who received that training. And those shotguns I still see around their necks when I go in for my jail
Well, I
visits.
could understand
Yeah.
questions about the weapons.
Okay, yeah, so the training very much involves the weapons. The weapons were actually required by Joseph Garcia and Seesaw for this training, which is why this is all relevant. So again, I will ask, the officers that were trained by Joseph Garcia and Seesaw, did they then train any other officers in the jail, either in the Seesaw practices or any other jail operations?
The current CRU team received similar training, but not the same.
Okay. And who conducted that training?
The team commander.
Okay. And was the team commander trained by Joseph Garcia and Seesaw?
He was a part of that program, yes.
Okay. Okay. Can you list any differences between the Seesaw Joseph Garcia training and the current CRU team's trainings?
I did not observe or participate in the CRU training, so I can't draw any differences to them, no.
Okay. Is that odd that someone of your level in the administration is unaware of the training of the CRU team?
I have every confidence in the team commander that he trained them appropriately.
Okay, who is the team commander?
Major Beta Kiefer.
And to confirm, the CRU team is still active in the jail today?
Yes.
Okay. And are those the folks that I see with the guns around their chest when I'm in there?
They carry the delivery systems, yes.
Delivery systems, right. I knew there was another word that you guys used for that. And what is being delivered by the delivery systems?
I'm not going to get into specifics of the items that we have in the jail.
Is there a projectile that is delivered from the delivery system?
Again, I'm not answering that in this forum.
Okay, but something is delivered, hence the name delivery system, right? Okay, yeah. Wow. Okay. How long did Joseph Garcia and Seesaw's training in the jail last?
I don't recall.
Can you give me an estimate? Was it 1 month, 8 months?
Several months.
Several months, okay. And what all, I know you said that there aren't any specific training materials, but what types of training? Were there lectures, demonstrations, videos,
I'm going to
tacticals?
ask you to move on. This is so not relevant. Just ask if they're still using these methods today.
Okay. Are the delivery systems being used today in the jail?
I
The
just,
delivery systems that you just referenced, they're being used in the jail today?
the CRU has them, yes.
Yes. Are they being used in the jail today?
They're deployed in the facility, yes.
Are these the Kel-Tec weapons that were purchased in the initial Seesaw Joseph Garcia
Ms.
contract?
Hallam, this is all under our use of force policy. I cannot discuss. I can't get into details with this.
You just said I could ask this.
I asked you to ask if the methods that were taught by this Garcia person were still being used today. Instead of asking who was trained, how many people were trained, who did the training, when were they trained?
Okay, thank you. Did the Joseph Garcia and the Seesaw training include the delivery systems?
Yes.
Okay. Have any new officers been trained on the delivery system since the Joseph Garcia Seesaw training ended?
Can you ask that again?
Yeah. Since the Joseph Garcia Seesaw training ended, have any new trainings taken place with the delivery systems from those trainings?
The CRU training, yes.
Okay, thank you.
Okay, but your question assumes that the CRU training is the Joseph Garcia
No, we clarified that it was
training.
not.
It's not.
But it's the
Okay.
same weapons that are being used and are being trained even after that training had ended, right? Did we clarified that? Okay.
Is it the same weapon?
It is, Your Honor.
Okay.
Yeah. This board banned them. We passed a motion of this board to ban them. And so I'm wondering, what are we going to do? Because they just admitted that they have violated that.
For clarification, the board did not ban the delivery systems. They banned us from bringing in additional equipment.
Okay, I can't speak to that. I don't know. I wasn't.
So has any equipment been brought in relation to the delivery systems?
No.
Ammunition, projectiles,
No.
accessories?
I don't know what you mean by accessories, but
Any
no.
accessories relating to your delivery systems?
Any purchases would have to go through the controller's office, and we have not submitted for any purchases.
Okay.
No.
Is there any retraining on the use of those weapons that happens for folks who have been initially trained?
I'd have to follow up with the commander. I assume there's recertifications.
Thank you. Okay, my next and final line of questioning is about uses of force. So is it true that the jail's use of force policy requires the staff to take photos of any injuries sustained during uses of force?
It's contained within the use of force packet, yes.
So, yes?
Yes.
Who takes the photo? Is it correctional staff, healthcare staff?
It's usually the supervisor, operational supervisor that's on scene.
Okay, I'm sorry, I'm not familiar with that. Is that a correctional staff or is that administrative?
That would be a sergeant captain
A
usually.
sergeant captain, okay. What was the word you used?
Operational supervisor?
Operational supervisor, okay. Is there any instance in which the healthcare staff takes the photo of the use of force, of injuries that resulted from a use of force?
Not that I'm aware of, no. Correct me if I'm wrong, Deb, but
Is there a reason that we have non-medical staff taking photos of injuries?
it's not of any private areas.
What if it was?
We would still have to document it for reporting purposes.
So is there any reason why healthcare staff isn't tasked with that? Why it is operational?
I mean, if it would come up of, if it was in an area of female breast or the groin areas or things like that, we could absolutely elicit the assistance of healthcare staff.
Okay, so I guess then to expound on that, so only when injuries happen in covered areas of the body do healthcare staff assist in the documentation of the injuries?
Sure, right.
Okay. But yet they are the ones that examine the injuries to determine that the person is cleared to go back to general population?
Yes,
So they are examining every injury that happens?
absolutely.
So what is the need then for the operational supervisor to be photographing and one additional person having eyes on that injury and maybe re-traumatizing a victim?
It occurs at the same time.
The operational supervisor is there with the healthcare staff while the person is being examined. The operational supervisor is taking photographs?
Correct. We're providing security for the healthcare staff.
Okay, and taking photographs?
Yes.
Okay. Is the injury photo put in the incarcerated individual's electronic healthcare record?
I don't believe so, no.
Okay. But it is in the use of force packet?
Yes.
Is there a reason that treatment for an injury is not put in the individual's healthcare record?
So the healthcare staff that are treating the injury fill out their own reports, and that's entered into the healthcare record.
But they are not allowed to include that photo in that?
It's not that they're not allowed to. If they need to see the photo, they can contact any one of us and for reference.
But at no time has that photo been included in the healthcare record?
I'm not sure that the EHR even supports photographs being uploaded to it, but I don't access
Can we
that
find that
system.
out? Does it?
As Chief said, like every use of force has a medical staff person evaluate and treat everybody. Our documentation reflects all of that. If there's a situation where we do need a photo of something, we could request that if it's needed. But our documentation of how we treat users of forces is not, we don't need a picture. You know what I mean?
Does the electronic healthcare record support adding photographs to it?
We can.
And so when a person is released from custody, they are able to request their healthcare records from the jail, correct?
There is a process to go through the request medical records, yes.
Is there also a process for them to request the use of force packet?
That I can't answer on.
Only if it would be subpoenaed.
So an individual cannot request on their own accord the use of force packet that includes the photograph of their injuries?
Correct.
Okay. Okay, that's all I got. Thanks.
Anybody else? Manny?
Yes, let's go. In the interest of time, I'm only going to ask a few questions, mainly related to some of the public comments. A spokesperson from Penn spoke about the decrease in spending on food. I don't remember exactly what it was, but they recommended a registered dietitian on staff. So I guess my question is, do you have a dietitian on staff? It's my understanding, correct me if I'm wrong, Trinity makes the menu, Trinity supplies the food. Do y'all know if Trinity has a dietitian?
They do. She was here, what, a few months ago?
She was here and
that's who was
spoke
there.
to us.
Yeah, okay, I got you. Word. Do y'all have any power and influence in challenging what's on the menu? Only reason I ask is because there's been beans being served with every meal. Every time we go to the jail, we get complaints about use of force, about lockdowns, about tablets, and about food. So we're trying to figure out what influence we have in order to improve.
Typically, yeah, we can, as I walk around and those individuals talk to me as well about, healthier options, we look at what we can do with Trinity and also with the commissary options to, make sure that they have a healthy balance, even with the commissary. But yeah, we try to get, fruits, vegetables, whatever we can. I know they use juice as well a lot, but, within the budget that we have, so.
I got you. So y'all can impact what's on the commissary as well?
I'm sorry?
Y'all can change what's on the commissary as well?
We have the ability to look at what's offered from commissary and then adjust what we offer.
I didn't know that. All right, thanks. So one of the online commenters, we got a little packet here, is a woman named Linda, and her comment was about books that she ordered and that were not delivered to, the incarcerated individual. So my question is, why would those books not be delivered? I know there was like a beef with the books previously, but I thought that was worked out.
It was resolved, but I read her complaint before I came here today as well, so we're going to investigate that. Her complaint dates back before we started our current electronic processing system, so I will be reaching out to her to get that resolved.
Okay, thank you, appreciate it. Another online comment was about somebody trying to get somebody's personal items, and I'm assuming that it was somebody who was transferred out of the ACJ to another facility and their personal belongings were left in the jail. So what is the process, or like, is she able to get her, her loved one's personal items delivered to her? Overall, what is the process when somebody gets transferred to another facility? What happens to their items?
So that comment read as the individual that was referenced was transferred to an SCI. So before the individual was referenced, they should have been given the opportunity in the intake department to fill out a release of property form for their loved one or their friend from the outside to come pick it up. But I don't remember if there was a name specified in there.
Yeah, there is a name.
So we can look into it.
All right, so
see if that's in
if something is left behind, though, is there a process to make sure it gets to where it belongs?
Yeah, we hold, I think it's 30 days we hold the property for. It's usually longer, but I'll check it out when I get back.
Okay, thank you. Another question I have is related to something y'all talked about in the report. It was a program that y'all hosted, Let's Reimagine Reentry. I'm very excited that y'all hosted that program, and I appreciate that. Can you go into a little bit more detail about what that program consisted of?
I wasn't present for the presentation that they did on the pods, but that program offers services to individuals post-release. And so we've been trying to bring in some of those organizations to meet with folks on the pod, explain to them what services they offer, so that whenever people get released from the jail, they have access to connect with those agencies.
I appreciate that. I think that's extremely important. Can you explain how an outside program can, participate in doing something inside of the jail?
Sure. They typically reach out to myself or one of the program administrators, and we coordinate them coming in. They would have to have clearances, as anyone does, and then we set up appropriate times for them to come in. It depends on what services they offer. If we think that that's something that's valuable to our population, then we allow those presentations to take place.
I got you. So that leads into my next question about NA. Have there still been no inquiries about that?
So we have put out additional requests for assistance for NA. Foundation of Hope has been working really hard trying to coordinate with some community volunteers to see if we can get some NA members in. We have had some interest. We're waiting for clearances to be submitted to see if we can get them on board.
Somebody submits clearances. About how long does that take?
About 7 days.
Okay. All right. My last question is related to, I guess, reentry or like the discharge center. As y'all know, we post outside of the jail. So quite a few times I asked about folks getting released without having access to their money. Last couple times it seemed to be like it was resolved, like y'all had a cashier there. But the last time we were there, I think it was, 2 weeks ago. It was the 24th. There were like quite a few folks who got released, and they said that they did not have access to their money. So what reasons would there be for someone to not have their money, given to them by a cashier?
The only reason, as Deputy Toma has alluded to several times in the past couple meetings, is staffing in the cashier's office. They have been onboarding a new employee, and they also are looking at hiring for additional positions so that they can support staffing in the cashier's office at more extensive hours than what's currently happening.
I got you. So currently, it's not staffed all the way until, releases are happening?
It is currently, but if someone's on vacation or a call-off happens, sometimes those staffing issues can arise.
Okay. All right. I think that's it for me.
Anybody else? Okay. The July meeting has been rescheduled because the next meeting is July 4. I can't find the date. July 17, thank you, at 4 o'clock. So the next meeting will be July 17 at 4 o'clock. And I believe that's everything. Meeting adjourned. Yes.
I just want to know why.
I watched.